Imagine this. In what might be your most chaotic, vulnerable moment, a highly trained professional steps in. They bring immediate calm, undeniable skill, and, well, critical care. We're talking about emergency medical services, or EMS, the system that's literally there when seconds count. But for someone who follows the world of emergency response, how deeply have you considered the incredible network of people, the hidden history, and the constant innovation that truly underpins every single siren and flashing light? Welcome to the Deep Dive, and today we're peeling back the layers on EMS. We all know it's more than just an ambulance ride. It's, a collaborative team of healthcare professionals. And at the heart of this system is the emergency medical technician, the EMT. Their compassion and skill have a profound impact, whether it's a high-stakes emergency or maybe a seemingly routine call. Our mission for you today is to unravel the complex and often surprising world of EMS. We're going to dive into the rigorous journey of becoming an EMT, explore the fascinating and sometimes overlooked history that built this system, and we'll illuminate its intricate operational components and its critical evolving role in public health. Prepare for truly surprising insights and a crystal clear perspective on this absolutely essential public service. Okay, let's unpack this. For someone who wants to be one of these frontline heroes, ready to respond when you need them most, what's the real journey like? To get to that point of being able to deliver care, it sounds incredibly demanding.
It absolutely is. And it starts with a foundational education built around core knowledge, skills, and abilities. But what's crucial to understand is that this isn't a one-and-done achievement. Healthcare is constantly evolving, which means an EMT's education is truly a continuous journey. It extends far beyond those initial courses.
That continuous journey sounds incredibly demanding. For an EMT already working intense shifts, what's the biggest challenge in truly keeping up with that evolving healthcare landscape?
Yeah, it often comes down to finding time and, resources for ongoing training, staying current with protocols, adapting to new technologies or medical advancements. That's really why the system is designed with multiple layers of verification. After that foundational education, the next critical step is certification.
Right, certification.
This is where a national body, like the National Registry of EMTs or an RMT, steps in.
And what's truly innovative about the NRMT's approach, I think, is that they don't just guess what's important for an EMT to know. They actually analyze real-world emergency call data from across the country, from NEMSIS, the National EMS Information System,
Exactly.
to ensure their certification exams test only the most critical practical skills an EMT needs on the street for safe and effective care. It's a data-driven validation process.
Exactly. Once you have that national certification, you then move to state licensure. Think of NRMT certification as proving you meet national clinical standards, while state licensure is what gives you the legal authority to actually practice where you live and work.
Okay, so it's a state-by-state legal green light.
Precisely.
And even with that state license, there's another layer of qualification that can come into play locally, right? That's where credentialing steps in.
That's right. Credentialing is more of a local or regional verification, often overseen by a physician medical director. It allows EMTs to perform specific techniques or, work in particular care systems. It basically provides a pathway for further specialization and ensures local medical oversight.
So, to even get to the point of certification and licensure, what are the baseline requirements? Beyond the training itself, what must an aspiring EMT demonstrate?
Well, the list ensures competence and trustworthiness. You need a high school diploma, immunizations, a background check, drug screening, a valid driver's license. And of course, you need to successfully complete a BLS CPR course, a state-approved EMT course, and pass both the state-recognized written and practical certification examinations. It's a rigorous gateway designed for public safety.
Makes sense.
And it's important to acknowledge the Americans with Disabilities Act, the ADA of 1990. This act protects EMTs with disabilities seeking employment by requiring employers to make reasonable accommodations. It ensures that ability, not disability, defines their role.
That's crucial. And beyond those legal protections, that continuous learning journey for an EMT means they constantly need to hone their learning strategies. This isn't just about memorizing facts, is it? It's about being able to apply information under pressure.
Absolutely.
Which is why things like high-fidelity simulations and real-world clinical experience are so vital for preparation.
What's fascinating here is how carefully tiered these roles are. Each one builds on the last to create a comprehensive, layered response to any emergency. There are 4 main licensure levels: Emergency Medical Responder, EMR, Emergency Medical Technician, EMT, Advanced EMT, AEMT, and Paramedic.
The EMR is often the unsung hero, right? That crucial first step. These are first responders like law enforcement, firefighters, park rangers, typically on scene first.
Mm-hmm.
They initiate immediate basic life support, help manage that initial chaos before the ambulance even arrives.
Yeah, and it's amazing how much difference even basic interventions can make, like directing trained bystanders to use a public AED, an automated external defibrillator.
Huge difference.
Following that, the EMT holds a central and incredibly demanding role. They possess additional depth and breadth of training in basic emergency care and transportation. While they might not always be the absolute first to arrive, EMTs commonly focus on initial scene stabilization and fundamental emergency care. They really serve as the primary link between the emergency scene and the healthcare system.
I think for many people, what might seem like a minor call to an EMT could be a life-altering emergency for the patient.
Hmm.
So an EMT's duty is to provide that care with the same compassion, whether they personally consider it life-threatening or not. That takes, wow, a lot of emotional intelligence.
Absolutely. Building on that, the AEMT steps up with specific aspects of advanced life support, or ALS. This includes things like intravenous or IV therapy, advanced airway management, and the ability to administer certain emergency medications. AEMTs are strategically vital. They often fill critical gaps in regions where paramedic availability might be limited, sort of bridging basic and advanced care.
And then, at the pinnacle of pre-hospital care, you have paramedics.
Paramedics possess the greatest breadth and depth of education and training. Their focus is on comprehensive ALS assessment, diagnostic and treatment tools like interpreting heart rhythms, advanced airway management, and emergency pharmacology. They truly function as part of a collaborative response, working under physician medical direction to extend the reach of the entire healthcare system right into the field.
Okay, here's where it gets really interesting, I think. The history of modern EMS isn't ancient, but it's a story of significant transformation, often driven by wartime innovation and then, shockingly, by stark domestic need. We can trace some early influences back to the battlefield. Volunteer ambulances in World War I, corpsmen in World War II, but it was truly the Korean War that saw the evolution of the field medic and rapid helicopter evacuation that dramatically advanced immediate trauma care.
Yeah, but contrast that wartime progress with the fragmented and often dangerously inadequate emergency care right here in the United States as recently as the 1960s. Services varied wildly. In some cities, hospital interns might provide care, but in many communities, the local funeral home used to hearse, or the police or fire department deployed a station wagon with maybe just basic first aid kits.
Hmm.
Many places had no formal pre-hospital care at all. Patients were often transported by relatives. It was a true patchwork, and frankly, a national embarrassment.
That's hard to imagine, isn't it? Just completely inadequate. But the turning point came in 1966 with a thunderclap of a report. Accidental Death and Disability, the Neglected Disease of Modern Society.
Oh.
This document from the National Academy of Sciences National Research Council ripped back the curtain on the truly shocking state of emergency care. It forced a long overdue reckoning.
That report had a profound, almost immediate impact. It spurred congressional mandates, leading to the Highway Safety Act of 1966 and the Emergency Medical Services Development Act of 1973. These acts created crucial federal funding and programs, really laying the groundwork for modern pre-hospital care. It was the Department of Transportation, the DOT, that developed the first curriculum for EMT training in the early 70s. And the first EMT textbook, Emergency Care and Transportation of the Sick and Injured, the famous Orange Book, was published in 1971. It essentially professionalized the field almost overnight.
Wow, the Orange Book. And that move towards national standardization really gave EMS a clearer identity. It reminds me of how NHTSA, the National Highway Traffic Safety Administration, also created that now iconic symbol we all recognize, the Star of Life. For someone who sees it everywhere, what does each of its points actually represent?
It's a powerful symbol, definitely packed with meaning. Each of its 6 bars represents a vital EMS function: detection, reporting, response, on-scene care, care in transit, and transfer to definitive care, and the serpent and staff at its center. That symbolizes medicine and healing. The skin-shedding serpent is indicative of renewal, a perfect metaphor for the continuous dedication of EMS.
That's great context. But despite these incredible advancements, challenges remained, right? Particularly in the 80s and 90s, due to lingering state-by-state variations in EMS provider definitions. It seems like the system had to keep fighting for true national cohesion.
Exactly. This prompted NHTSA to create the EMS Agenda for the Future and its 2019 revision, EMS Agenda 2050. Both were aimed at driving national standardization and a truly seamless delivery of care across state lines. If we connect this to the bigger picture, EMS Agenda 2050 truly represents a forward-thinking redefinition of emergency care. It deliberately places the patient at the very center of its vision.
That people-centered vision stands out. It's not just about saving lives, is it? But focusing on reducing physical, emotional, and psychological suffering. That's a significant shift.
It absolutely is. It's a more holistic approach, moving beyond just the critical intervention. The agenda is guided by 6 core principles, but 2 that really stand out for maybe their challenging nature are socially equitable and adaptable and innovative.
That socially equitable principle is especially critical. For someone who follows EMS, what's a surprising, perhaps often overlooked, barrier to equitable access, something EMS is uniquely positioned to address, and how are they tackling it?
Oh, a huge barrier is simply geographic isolation and socioeconomic status. Think about rural communities or underserved urban areas where transport might be difficult, or where trust in the healthcare system is low. EMS is uniquely positioned because they go to the patient wherever they are. Addressing this means integrating with local social services, utilizing community paramedicine to extend care into homes, and advocating for funding models that support these often unprofitable but critically necessary services. It's a long game for sure, but EMS is on the front lines of closing those gaps.
So with this forward-thinking vision, what does it all mean for how an emergency call actually unfolds, and how this intricate system operates day to day to deliver that people-centered care?
Well, it begins with public access. Easy access to help is critical, primarily through 911, with enhanced systems that can display a caller's address, which is amazing. But then comes emergency medical dispatch, or EMD. This is where trained dispatchers, using carefully developed scripts, obtain vital information, and incredibly often provide crucial instructions to callers before EMS even arrives, like how to do CPR. They're the unseen heroes of those first few minutes.
That's a huge responsibility, and those dispatchers are working with information that might be incomplete or even inaccurate due to the limitations of technology and just the chaos of an emergency.
Exactly. Then you have the human resources, the people who actually deliver the care. This involves not just paid professionals, but also dedicated volunteers. And there are ongoing efforts to facilitate interstate mobility for providers through national registry certification and initiatives like the Replica Compact, which extends privileges for short-term practice in other member states. It's about ensuring skilled providers can serve where they're needed most.
And underpinning all their actions is medical direction. That sounds vital.
Absolutely crucial. Each EMS system has a physician medical director who authorizes EMTs to provide medical care in the field. Think of offline control as your established playbook, those standing orders and protocols you follow routinely. Online control. That's when you're on the phone or radio with a doctor getting real-time, specific guidance for a complex or unusual situation. The medical director essentially sets the scope of practice and ensures consistent, high-quality care.
The integration of health services is also key to preventing errors and ensuring smooth transitions, isn't it? Less chance of things falling through the cracks.
It's vital. Coordinated pre-hospital and hospital care is paramount. A fantastic example is pre-notification for time-sensitive treatments like heart attacks, trauma, or stroke. EMS alerts the hospital before the patient arrives, so specialized teams are ready to go the moment they roll through the doors. That seamless communication when transferring patient care to the ED can be a literal game changer.
What's fascinating here is the evolution of mobile integrated healthcare, MIH, and community paramedicine. This really embodies that people-centered vision of Agenda 2050, doesn't it? Moving beyond just emergency response.
It really does. MIH is a transformative method of delivering healthcare within the community, moving beyond just a physician's office or hospital to improve access and affordability. It actively connects patients with other valuable resources like social services, addressing the root causes of health issues, not just the symptoms. And community paramedicine leverages experienced paramedics with advanced training. They provide additional services like health evaluations, monitoring chronic illnesses, obtaining lab samples, administering immunizations, and serving as true patient advocates, sometimes preventing calls to 911 in the first place.
So it's about getting ahead of the curve, being proactive, not just reactive.
Precisely. And here's a little street smarts tip for all EMTs out there. Always try to empathize with patient anxiety. What may not seem like an emergency to you is absolutely one to them and their family. That perspective is critical.
Good point. Beyond the human element, technology plays a huge role in information systems. How does all the data collected actually help improve care?
Oh, computers are essential for efficiently documenting patient care. And this electronic information, often gathered through NEMSIS, is a goldmine. It's used to improve care by constructing educational sessions, justifying staffing and equipment purchases. And combining with hospital data to determine patient outcomes, it's how the entire system learns, adapts, and grows.
And of course, there's system finance, which I imagine can be incredibly complex.
Funding for EMS departments is incredibly diverse. Taxation, fee-for-service, grants, donations, sometimes combinations. EMTs are directly involved through proper documentation, which impacts medical insurance claims, grant eligibility, and adherence to HIPAA. But what's really innovative are pilot programs like ET3 Emergency Triage, Treat, and Transport. This reimburses EMS for providing the right patient with the right care at the right time, including on-scene treatment or transport to alternative destinations, not just crowded emergency departments. It's a real shift towards value-based care. This raises an important question. What defines not just what an EMT does, but who they are, in terms of their professional ethos and the trust they build? At the core, the guiding principle for all EMS personnel is everything you do needs to be done with the patient in mind. The EMT is truly a patient advocate, often speaking for those who cannot speak for themselves.
Beyond the obvious skills, the day-to-day roles and responsibilities of an EMT are incredibly varied. It's more than just driving an ambulance, right? What are some of the less apparent but equally critical aspects they juggle?
Oh, definitely. Beyond immediate patient care, EMTs are maintaining complex vehicles and equipment, ensuring safety for themselves, their partners, patients, bystanders, operating emergency vehicles under intense pressure. But perhaps most critically, they're providing crucial emotional support in crisis situations, maintaining meticulous continuity of care, upholding strict medical and legal standards, and often being local community liaisons. It's a unique blend of highly technical and deeply human skills.
That sounds like it demands a profound level of professionalism,
Yeah.
almost constant vigilance.
Absolutely. EMTs are expected to possess key professional attributes: unwavering integrity, deep empathy, self-motivation, appropriate appearance, and hygiene, self-confidence under pressure, expert time management, effective communication, teamwork and diplomacy, respect, and meticulous delivery of care. They embody a deep commitment to the patient, often in incredibly challenging circumstances.
And that professionalism extends to handling incredibly difficult situations. You mentioned compassion earlier. EMTs are expected to remain non-judgmental, understanding, and professional, even with uncooperative, demanding, or, frankly, verbally abusive patients, recognizing that stress can lead to inappropriate behavior. That requires a very thick skin, doesn't it?
It does. It requires immense emotional resilience and the ability to de-escalate with compassion. And underpinning all of this is patient confidentiality. It is critically important. EMTs must not discuss findings or patient disclosures with anyone but those directly treating the patient, or in very limited legally required situations. Familiarity with IPEN, the Health Insurance Portability and Accountability Act, is absolutely essential to protect patient privacy and avoid serious repercussions, both for the patient and the provider.
Okay, so no matter how skilled or dedicated in these high-stress environments, errors can happen. It's human. So how do EMS systems actively work to prevent mistakes and continuously get better, to ensure the highest standard of care for you, the patient?
It involves multiple layers of evaluation and quality control, from state offices and medical directors right down to individual providers. A significant strategy here is what's called a just culture.
That just culture sounds ideal, encouraging reporting without fear. But in a high-stakes environment like EMS, how challenging is it to truly foster that trust and openness, especially when mistakes can have such severe consequences?
It's incredibly challenging, but vital. It's about balancing fairness with accountability. The core idea is that you hold employees accountable for their behavioral choices, like recklessness. But the system also focuses on identifying systemic risks and designing for safety. It encourages trust and error reporting, not to blame, but to understand why things went wrong, so causes can be found and prevented. It's a continuous learning loop.
That makes sense. This leads directly into continuous quality improvement, or CQI, right?
Yeah. Exactly. CQI is a proactive quality management process. It encourages team members to constantly ask, how are we doing now and what can we do to be better? It often uses a plan, do, study, act cycle. Gather information, generate improvement ideas, enact them, evaluate the results, and then adopt the positive changes. The ultimate goal is to become a high reliability organization, an HRO, with a profound commitment to teamwork, a culture of safety, in CQI to prevent errors before they happen.
Patient safety and error reduction are paramount. What are some of the most common sources of errors in EMS, and how are agencies and individual EMTs working to prevent them?
Well, common sources include driving, lifting patients, which causes a lot of back injuries, and communication failures. These can often be categorized into rules-based, knowledge-based, or skills-based failures. Agencies actively work to reduce these with clear protocols, better environment management like limiting distractions, improving lighting, ensuring organized equipment. EMTs also play a crucial role by being vigilant patient advocates asking, "Why am I doing this?" before performing a skill. Seeking help from partners or medical control when unsure, using checklists, and actively participating in post-call debriefings to learn from experiences. For example, during patient transport, concerns about proper lifting techniques, using restraints correctly, avoiding distractions while driving, and clear communication are all critical safety considerations.
Okay, this next component is often overlooked, I think, but it's where EMS truly contributes to the broader health of our communities, shifting from purely reactive care to proactive well-being.
That's the realm of public health. Its focus is on examining the health needs of entire populations with the goal of preventing health problems before they even start.
And it's an area of vital importance, especially given the U.S. healthcare context. We spend, over 17.7% of our GDP on healthcare, yet our average life expectancy is 79 years lower than 29 other countries. Those statistics really underscore the urgent need for prevention strategies, don't they?
They absolutely do. That's where primary prevention comes in. Strategies that prevent an event from ever happening. Think about community education programs run by EMTs on things like pool safety, car seat installation, or fall prevention for older adults, or simply teaching first aid and CPR. These small actions by EMTs can lead to genuinely big differences in public health outcomes.
Right, preventing the emergency in the first place. Then there's secondary prevention,
Yeah,
which involves efforts to limit the effects of an injury or illness that has already occurred but couldn't be entirely prevented.
Exactly. Helmets and seatbelts don't prevent the accident itself, but they limit the injury severity. Improvements in guardrail construction are another example. EMTs contribute here by educating the public, like stressing helmet use after responding to a bike accident, and through injury surveillance. They use their patient care reports to help identify dangerous intersections, for instance, which can lead to changes that prevent future crashes. All this public education isn't just about safety. It increases public respect for EMS, helping people understand their vital role in the public health system. That understanding, in turn, can lead to increased funding and greater professional recognition for EMTs. It's a positive cycle.
And it's not just about tradition or gut feeling. Modern EMS is a science, constantly evolving. So how does research directly shape the emergency care you receive, making it truly evidence-based?
Yeah, there's been a significant shift to evidence-based medicine, or EBM. Early EMS care was often guided by expert opinion, maybe tradition. But today, EBM focuses on procedures proven useful in improving patient outcomes, supported by robust research. Resources like the National Model EMS Clinical Guidelines are directly based on current research and expert consensus.
And EMTs are directly involved in this research process, aren't they? They're not just consumers of the research findings.
Crucially, yes, EMTs are on the front lines, gathering accurate data from every single call they respond to. That data is vital. They may also participate in specific research projects like studies on oxygen administration or new resuscitation techniques. This collected information is then rigorously analyzed to answer critical questions and continually improve patient care practices across the board. Organizations like IL-4, the International Liaison Committee on Resuscitation, and the American Heart Association regularly update their guidelines based on new medical evidence. That showcases EBM in action. It ensures the care you receive is always based on the latest, most effective practices, and that's, well, an incredible testament to the field's commitment.
Wow, what an incredible deep dive. We've truly explored the hidden complexities today. From the rigorous journey of becoming an EMT and the system's surprising wartime origins to its modern, people-centered vision in EMS Agenda 2050. We've seen how its intricate operational components drive daily care and the relentless pursuit of quality, safety, prevention, and evidence-based practice.
Indeed. It's clear that EMS is a dynamic, critical, and continuously evolving part of the entire healthcare continuum, deeply rooted in history and constantly innovating for the future. It's far more than just an ambulance ride, isn't it? It's a meticulously crafted system designed to provide comprehensive, immediate, and increasingly proactive care, ensuring that someone is ready for you when you need them most.
So next time you see an ambulance or hear a siren, Maybe pause and consider the incredible network behind it. The historical development, the meticulous training, the continuous innovation that ensures someone is ready to respond. What unseen elements of this system might be at work in your community, quietly ensuring safety and health every single day? And how might your deeper understanding change the way you view this absolutely essential service?